Hello everyone. Today we are going to learn about antipsychotic drugs in a very simple and interesting way. So before learning the drugs, first we must understand what psychosis actually means. Because if students understand the disease properly, then understanding the drugs become very easy. Normally our brain helps us understand what is real and what is not real. It controls our thinking, emotions, behavior, speech, memory, and reactions. But in some mental disorders, the person slowly loses contact with reality. The brain starts interpreting things abnormally. The patient may hear voice even when nobody is speaking, may see things that are not present, may believe false ideas strongly, and may behave strangely. This condition is called psychosis. One of the most important diseases associated with psychosis is schizophrenia. In schizophrenia, the patient may become suspicious, isolated, emotionally disturbed, fearful, aggressive, or confused. Some patients may feel that somebody is controlling them, following them, or trying to harm them. Some may hear imaginary voices continuously. These symptoms can seriously affect the patient's life, family, work, and social interactions. Now, the question is, why does psychosis happen? The exact cause is complex, but one important theory says there is excessive dopamine activity in certain pathways of the brain. So, dopamine is a neurotransmitter. Neurotransmitter means a chemical messenger that carries signals from one nerve cell to another nerve cell. Normally, dopamine is important for motivation, reward, emotions, movement, and thinking. But when dopamine activity becomes excessive in certain brain areas, especially the mesolimbic pathway, abnormal thoughts and hallucinations can occur. So, scientists developed drugs to reduce this excessive dopamine activity. Those drugs are called antipsychotic drugs. So, the main mechanism is dopamine D2 receptor blockade. Dopamine receptor blockade decrease dopamine activity and decrease psychotic symptoms. This means antipsychotic drugs block dopamine receptors and reduce excessive dopamine signaling, thereby controlling psychotic symptoms. Now, let us move to classification. Antipsychotic drugs are mainly divided into two groups: typical antipsychotics and atypical antipsychotics. First, typical antipsychotics. These are also called first generation antipsychotics. These are older drugs, for example, chlorpromazine, haloperidol, flupenazine. These drugs strongly block dopamine receptors. They are very effective in controlling positive symptoms like hallucination, delusion, aggression, abnormal behavior. But because they strongly block dopamine even in movement pathways, they commonly produce movement related side effects called extrapyramidal symptoms. Now let us understand extrapyramidal symptoms or APS. So dopamine is also important for smooth muscle movement control in the brain. When dopamine becomes excessively blocked in the nigrostriatal pathway, movement disorders can occur. So the patient may develop tremors, rigidity, slowness of movement, mask-like face, restlessness. These symptoms resemble Parkinson's disease. This drug-induced condition is called drug-induced Parkinsonism. Some patients may also develop dystonia. Dystonia means painful muscle spasm. The neck may twist suddenly, eyes may roll up upward, or facial muscles may become abnormal. Another condition is akathisia. Akathisia means a patient cannot sit calmly. The patient feels inner restlessness and continuously moves around. So long-term use can also produce tardive dyskinesia. This causes abnormal involuntary movements like lip smacking, tongue movements, facial switching. Sometimes these changes may become irreversible. Now let us move to atypical antipsychotics. These are second generation antipsychotics. For example, risperidone, olanzapine, quetiapine, clozapine, ziprasidone. These drugs block both dopamine and serotonin receptors. Because of this balanced action, they usually produce fewer extrapyramidal side effects compared to typical antipsychotics. Many doctors nowadays prefer atypical antipsychotics because they are better tolerated by many patients. Now, let us discuss some important drugs individually. First, haloperidol. Haloperidol is a highly potent typical antipsychotics. It is commonly used in acute psychosis, severe agitations, aggressive behavior, emergency psychiatric conditions. It strongly blocks dopamine receptors, so EPS is common. Next, chlorpromazine. Chlorpromazine is a low potential typical antipsychotic. It causes sedation, hypotension, and cholinergic effects. Patients may become sleepy because it also blocks histamine receptors. Next, risperidone. Risperidone is an atypical antipsychotic commonly used nowadays. It causes less IPS but can increase prolactin levels. High prolactin may produce galactorrhea, menstrual irregularities, breast enlargement. Next, olanzapine. Olanzapine is effective and commonly prescribed, but it may cause weight gain, increased appetite, metabolic syndrome, and diabetic risk. Clozapine. Clozapine is very important. It is especially used in treatment resistant schizophrenia, meaning patients not responding to other drugs. It is very effective but has one dangerous side effect called agranulocytosis. Agranulocytosis means severe reduction in white blood cells. Because WBC decreases, the infection risk becomes very high. So patients using clozapine need regular blood monitoring. Now let us discuss therapeutic uses of antipsychotic drugs. So these drugs are used in schizophrenia, acute psychosis, bipolar mania, severe aggression, delirium, uh, Tourette syndrome, and drug-induced psychosis. Some antipsychotics are also used as antiemetics to control vomiting. Next, we will discuss the side effect of antipsychotic drugs. First, neurological side effects are tremors, rigidity, dystonia, akathisia, tardive dyskinesia. And second, endocrine side effects are hyperprolactinemia, menstrual changes, and sexual dysfunction. Third, metabolic side effects weight gain, hyperglycemia, increased cholesterol. Next, autonomic side effects are dry mouth, constipation, blurred vision, and urinary retention. Cardiovascular effect are orthostatic hypotension, QT prolonged in some drugs. Dangerous complications student must remember is neuroleptic malignant syndrome. This is rare but life-threatening. The symptoms include high fever, muscle rigidity, altered mental state, autonomic instability. So this is a medical emergency. Now let us understand one interesting concept and antipsychotics mainly improve positive symptoms better than negative symptoms. Positive symptoms means symptoms added to normal behavior, hallucination, delusion, aggression. Negative symptoms means loss of normal function, lack of emotion, social withdrawal, reduced speech, lack of motivation. Atypical antipsychotics may help negative symptoms slightly better than older drugs. So, psychosis occurs mainly due to abnormal neurotransmitter activity, especially excessive dopamine activity in certain brain pathways. Antipsychotic drugs mainly work by blocking dopamine receptors and reducing abnormal brain signaling. Typical antipsychotics are older drugs with higher extrapyramidal side effects, while atypical antipsychotics are new drugs with additional serotonin blockade and fever movement related side effect. These drugs play a major role in controlling schizophrenia, hallucination, delusions, aggressions, and other psychotic disorders, thereby helping patients return closer to normal thinking and behavior. So, thank you all. This is the basic and important overview of antipsychotic drugs. Once again, thank you all.